The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. It's called bariatric surgery. It's weight loss surgery, and there are several different kinds. But surgery itself is not a magical solution. Lifestyle and diet changes are necessary to maintain long-term weight loss. If you have questions today on weight loss surgery or nutrition, give us a call. The experts are here to answer your questions. And those experts are Dr. Lindsay Sharp, a bariatric surgeon with Rex Surgical Specialist, and Mary Gray Hutchinson, a dietitian with Rex Surgical Specialist. To call us here at Rex on Call, just dial that number on your screen. In Wake County, call 919-744-3876. Outside of Wake County, call us toll-free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com. You can even find us on Twitter. Send us a question at Rex Healthcare, #RexOnCall. The results from weight loss surgery can be dramatic, but it doesn't mean that there isn't effort required. Here's Linda Hester with her success story.
It's hard for me to believe that that was me 2 years ago. It just blows me away at what I've accomplished.
In the 2 years since Linda Hester's weight loss surgery, she's lost 125 pounds and gained a new lease on life.
It was difficult getting around, walking. As a hobby, I show dogs. And it had gotten to the point that I couldn't show my dogs anymore because it was that difficult to get around the ring with my knees.
As a patient at Rex Surgical Specialist, Hester still participates in healthy cooking classes, support groups, and even serves as a mentor for pre-op patients. After all, the surgery isn't the only key to weight loss.
Success is not about the operation. Success is about accepting lifestyle change, and that's in terms of exercise, and we expect people to exercise 4 to 5 days a week, changing your diet pattern to eating healthy foods, not just eating the same foods that you ate before.
Bariatric surgeon Dr. Peter Nong says lasting results only happen when they treat the whole patient.
We call it an integrated approach, using psychology, dietitians, personal trainers, and physicians all arm in arm and trying to help patients get better.
As for Linda, she's back showing her dogs. In fact, she walks 2 miles a day. What's it like to look at that picture? That picture looks like a different person.
It brings tears to my eyes. Because you don't realize what you look like until you've lost all this weight and you look back. So it's so much joy. It's tears of joy.
Well, thanks to Linda for sharing her story, and what a wonderful story that was. And she works with you guys at Rex Surgical Specialist. I mean, she still is going to those pre and post or the post-op, support groups. So we'll talk a little bit about that. Dr. Sharp, tell us. And there have been questions already about what is the difference between lap band and the gastric sleeve. What are the differences?
Sure. Lap band is an implantable device that helps control the rate that someone can eat following surgery. Sleeve gastrectomy is actually a stapled gastric operation that reduces the volume of the stomach and also has a number of hormonal changes that helps people lose weight.
Okay, you're doing more of the sleeve, you had said?
Nowadays we are, as of about 2 years ago, most major insurance companies have started covering the sleeve. It seems to be a bit more effective than the lap band overall.
And how do you decide which patient is right for which procedure?
That's the million-dollar question. I mean, a lot goes into it. We look at how much weight someone needs to lose, what are their comorbidities that they're trying to address through weight loss surgery, and really try to pair the right operation with the lowest risk for that patient.
Okay, and Mary Gray, you work with them on the nutrition side, which is so important. Tell us, what are some of the big roadblocks that are facing folks after surgery?
I think some of the biggest roadblocks are planning and preparing meals and getting used to doing that before surgery versus planning on having surgery and then everything falling into place from that point. And so really getting used to taking responsibility for their own food choices, recognizing that out in the public there aren't a tremendous amount of healthy choices, though they're growing. It is better to be prepared and to know what you can eat and to pack healthy items.
So explain to us then how you work with people pre-operatively on that, because that's a huge adjustment for most people.
Well, preoperatively, we try to get patients to adopt some behavior changes, including eating more slowly, chewing their foods better, practicing not always drinking with meals, because after surgery that can really fill them up so that they're unable to get the vitamins and minerals that they need and the protein that they need in their diet.
Now, Dr. Sharp, are you still doing as many traditional gastric bypass surgeries?
I would say we're doing probably about 50-50. We're doing more and more gastric sleeve surgeries nowadays, but we're still doing a fair number of gastric bypasses as well.
Okay. And how do you decide who is an ideal patient for this, for an operative solution for this?
For operative surgery in general for weight loss, I would say someone who's certainly has tried to lose weight on their own and has not been successful keeping that weight off long term. The BMI criteria are a BMI of 35 plus comorbidities or BMI of 40 or more. When it comes into deciding which operation might be best for them, it's a little bit more nuanced in terms of which comorbidities are better addressed with each operation, what are the risk factors that the patient carries, and really trying to put that whole picture together.
Okay, and talk to us, patients come out of surgery, some, and they are cured from type 2 diabetes?
For many patients who have certain procedures, for example, the gastric bypass is very, very effective for putting patients with type 2 diabetes into remission. Depending on the amount of insulin or diabetic medication that they have required prior to surgery, many patients do leave the hospital, really haven't lost a single pound yet, but they're no longer on their diabetic medications.
And you see that people, that these people have not been able to lose weight. They've tried and they haven't?
Right.
I mean, and so that they need this surgery to do this, to make lasting results?
I think that the surgery is an excellent tool for patients to use to help them to get to their weight loss and health goals. It's not the quick fix, it's not the magic pill, it really takes work on their part. So it takes what they were doing maybe beforehand in terms of reducing their portion sizes and increasing their fruits and vegetables, but it's a tool that helps them to achieve those goals more easily.
Okay, great. Coming up next, a before and after you'll want to see, a live interview with one of WRAL's own on her weight loss journey, and later some more of your questions are answered by the experts here on our set. Stay with us. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on weight loss surgery. If you have questions for our experts, call in now. In Wake County, call 919-744-3876. And outside of Wake County, call us toll free at 877-277-6252. Email us your questions to rexoncall@rexhealth.com. Okay, you want to get to a few questions here. Now, Robin from Rocky Mount, she had lap band surgery a couple of years ago, and she's having issues with food coming up. Now, would lap band, if she had lap band before, would she now be a candidate for the sleeve procedure?
Absolutely. The same criteria still apply in terms of the BMI and comorbidity criteria, but patients with lap bands are still candidates for revision to sleeve or a gastric bypass.
Okay, and this is a question for you. I had surgery, went from 600 pounds to 320 pounds. That's awesome. How can this person continue to lose weight?
Well, there are a lot of questions that I would ask this person, including, what their physical activity is, how many carbohydrates are they eating every day, and are they meeting their protein goals? Another question that I ask anyone that walks into my office is, how are you doing in terms of your fluid intake? Because a lot of times hunger and thirst are confused with one another, and so we tend to eat versus drink some water to get us through to our next meal or snack.
A tune-up on nutrition might be necessary.
Exactly.
This is a question that came in from online. Had surgery 9 years ago and the weight is creeping back on. What do I do to keep it off?
So in terms of weight creeping back on, the first line of defense that I would recommend is go ahead and start writing down what you're eating, because a lot of times foods are sneaking in that we don't necessarily recognize are in our diets because we're just eating them subconsciously, or when we're really tired and not paying attention to how much we're consuming.
Okay, this question from Ms. Yarborough. How do I find out if I'm a good candidate for gastric bypass surgery?
Great question. There are a number of seminars that are held weekly in the area, and at our practice, I think the best place to start is with one of those, and come see the doctor.
Come see the doctor. Okay. Do you have to be at least 100 pounds overweight for surgery?
That really depends on height. BMI is determined by weight, but also height. So, and that's just variable.
Okay. This question from Gail King. Will Medicare cover the sleeve surgery?
They do.
Okay.
As of about a year ago, they have started covering the sleeve.
Okay, Willa Taylor, she had gastric bypass at Rex in October. Has a hard time eating meat. Are there other options besides protein shakes to make sure she's getting in her protein?
Oh, sure. Well, there are always your soy proteins that are really well tolerated after surgery, including tofu and tempeh, but then there's also seafood. It's a great option. It's less dense and much better tolerated.
Okay, now time for a special interview with Kieta Mangum, who directs Rex on Call and joins us now from WRAL's control room. She has had, look at her now. You see her now. Look at her. Gorgeous. Now, can we see that before picture? There it's still gorgeous in her before picture, but she had some health-related weight issues. So Kieta, talk to me about what inspired you to take this step to have this surgery.
I struggled with my weight for years. My family struggles with our weight, and when probably about 5 years ago, I was diagnosed with diabetes. I was having to prick my finger every day to check my sugar levels. I was on medication, and the doctors would tell me, if you lost weight, if you became active, it would help you bring your sugar under control. And I just struggled with it. I went through the Weight Watchers program that the company offered here. I tried different programs, different diets, Slim Fast, everything. I tried it all, and I would lose weight, but I would gain it back. And my mom was struggling with her weight as well, and we both kind of decided to get a little bit more information about the surgery. I stopped, listening to horror stories about it, and just went with my heart, and went to Dr. Sharp and went through that program and learned a lot about it, became confident with it, and decided, you know what, let's just do it. And I had the surgery, and a week later, my mom had it.
That's awesome. I mean, so we have the dream team on the couch here that you worked with.
Yeah, they're awesome.
And can you tell us what your results have been?
I had the surgery back in February of 2013, and since then I've lost 130 pounds.
Wow.
Yes.
You look amazing.
Awesome.
Now,
Thank you.
and so you must be so proud seeing your girl up there.
Absolutely.
Yeah, and talk to us, what is your advice for folks that might be considering this?
First of all, don't let fear stop you. The program, the surgery has been tried and tested. These are professionals. They know what they're doing. People are losing weight and being successful with it. Don't let fear stop you. Learn about it. Get into the program. Rex Bariatric with Dr. Sharp and everyone. Their program is awesome. Learn about it. Get into the program. And this is very important. Stick with it. Do what they tell you to do. It's not hard. Work out. Follow the plan. You still get to eat. You still get to enjoy foods. You still get to enjoy, sweets or whatever. You're just learning alternatives. And stick with it. Follow the plan. Stick with it. And don't let fear stop you. And another thing that's been very helpful is just be around people that are positive, people that support you. The program with Dr. Sharp, that program supports you, as well as be around family and friends who are positive and support you. And hang in there. You can do it.
Kieta, you look amazing. Thank you so
you.
much for sharing your story. And believe it or not, she wasn't even paid to say that. But thank you so much for sharing your story. And I know she said she just followed the rules, which is just, that's so amazing. Okay, well, thank you for that. And coming up, we're going to answer more of your questions in Wake County. Call 919-744-3876. And outside of Wake County, call us toll free 877-277-6252 or email us your questions to rexoncall@rexhealth.com. Stay with us. Welcome back to Rex on Call live here at WRAL. To reach us here, call one of those numbers on your screen. To Rex on Call at rexhealth.com. Now, it is more than just a surgery. At Rex, they take a look inside. They take a look inside one of the healthy eating classes that you offer. We were there, and let's take a look to see how it helps pre and post surgery patients learn how to revamp their favorite foods.
Pretty excited about this one. This one is our low sugar pulled pork barbecue. So the goal of this cooking class is to teach our patients how to prepare healthy meals at home. Prior to surgery, they're not really cooking as much oftentimes, and so we're trying to encourage them to get in the kitchen and take control of their health. Okay, the catch here is we need to trim off the fat. So it's got this fat. We started with more indulgent recipes and then we modified them down in terms of their fat. And onions are a great low-calorie way to add flavor. Those little tweaks make a huge difference in a recipe. Usually if you can tweak 2 or 3 different ingredients, you can make a big impact on the nutrition.
We're also going to use 1 garlic clove. This is a 32-ounce box. We're going to use half of it. And you're just going to pour that in.
I think that a lot of them think that it takes a lot of time and a lot of effort and that they don't have that time. And so today we're hoping to show them that they can fix really quick, healthy meals. A lot of patients may walk in thinking, oh, I'm just gonna have surgery and this is just gonna fall off. But the truth is it does take work. Perfect. Yeah.
Good.
Delicious.
That's great.
Oh, heck yeah. That's real good. It's better than anything I can make.
I went to that class and I learned a lot, I have to say. Okay, so let's get right to these questions. There's a lot of them. Linda from Hillsborough had bypass surgery 2 years ago and is gaining weight. What can she do to lose it again?
Yeah, and I think Mary Gray hit the nail on the head. Whenever we see someone who's thinking about revision surgery or what can they do for their weight gain, first thing we do, take an assessment of what their exercise and their eating habits are and get them back on track and really work in that arena.
Because we have several questions here about folks asking about revision surgeries, and even there's a question here of how many times can I have gastric bypass surgery?
Yeah, so again, when it comes to revisions, each of these operations have limitations, and so we really like to focus on finding the right operation the first time. If someone hasn't had the right operation the first time, then we look at what are the alternatives for that patient. And we just go from there.
Okay, Kathy Reed from Durham, palpitations, asthma, diabetes, can she still have the surgery?
Absolutely. All of those conditions that you mentioned are quite common in people who are thinking about weight loss surgery.
Okay, Alice Harris, considering surgery, but she had an accident leaving some scar tissue around her stomach. Does that affect her chance of getting the surgery?
It really all depends, and we just need to do a thorough assessment of her records to see what exactly has been done.
Okay, Sharon from Goldsboro, at what age do you start offering the surgery?
At Rex, the minimum age is 18.
Okay, and are you doing a lot of surgeries with folks that young?
Not really.
Okay. Is it Veronica Mills from Spring Lake wants to know if surgery is okay if you have a degenerative back disease?
Absolutely, and oftentimes getting that excess weight off can help with back pain and joint pain in general.
Okay. This Tretta says she has heart disease. Could she be considered for bariatric surgery?
Absolutely.
Okay. And this is another one, gastric bypass earlier and has put the weight back on. Are there procedures available? You're saying first go talk to Mary Gray.
Absolutely. First thing, you got to get back on track. That's the importance of lifelong follow-up after surgery. It's much easier to deal with some small amount of weight gain before it gets to be a real problem. But even in that situation, getting back on track and then taking a look at what the options are. Have there been any complications that may have contributed to the weight regain?
And Mary Gray, talk to us about the post-op, the programs you have. Just walking in there, it seems like there were a lot of post-op patients there. So talk to us about how you work that.
Well, in order to help a patient to be successful long-term, we like for them to stay connected with us. And that is one thing that we realize does help patients. So we've started several different programs. We've got a Staying on Track program that's during the day. It's a daytime support group where anyone can come free of charge to talk about issues that they're coming up against. So that's the Staying on Track. Then we've got post-op support group meetings that happen on the first and third Thursday of the month. We've got pre-op support group meetings as well. We've got grocery store tours that we're offering one time a month, as well as cooking classes. And so with the cooking classes, I think that's a big component that we are so proud of at Rex Surgical, and that is because we want to show our patients how to be successful in the long term, and that means learning how to prepare their favorite foods, but in a healthier way.
Absolutely, I think we could all learn from that. Okay, we're gonna have a final round of questions right after the break. This is Rex on Call. Stay with us. Welcome back to Rex on Call. We have a final round of your questions regarding weight loss surgery, so let's get right to them. Dorothy from Raleigh, after weight loss surgery, how does the patient deal with the excess skin? Exercise or surgery or both?
Great question. I think actually both is good. It's not really about the rate of weight loss. A lot of people worry about that. It's really about the overall amount of weight loss that results in excess skin. Some people are less prone to excess skin than others, but certainly muscle toning exercises can help. For some people, skin removal surgery may be needed.
Okay, Cynthia from Raleigh, if you have high blood pressure, can you have the sleeve procedure?
Absolutely. There are a number of comorbidities, probably 20 plus different medical problems that are benefited from weight loss surgery, including the sleeve.
Okay, this question from Durham, had gastric bypass 3 years ago, lost 160 pounds, feels great. Doctor wants her to gain some of the weight back. Do you encounter that pretty often?
We don't encounter that frequently, though when we do, we talk about this individually, one-on-one, and talk about incorporating some healthier foods back into the diet, maybe some higher calorie, healthier fat foods such as avocado, nuts, things of that nature to help patients regain weight. But that's a rarity. Usually patients end their weight loss journey at a goal that they're very happy with.
Okay, because the doctor wanted her to gain 25 pounds. Okay, question about fat. The pot belly is hard. Why is this belly, even after gastric bypass, why does he still have a pot belly?
That who knows? I mean, we definitely would need an evaluation there to kind of see what's going on. Sometimes folks have hernias. It's really, sometimes there are a lot of intra-abdominal fat or even tumors and things, so certainly would need an evaluation.
Okay, does insurance, we're getting a lot of questions on this, does insurance cover this procedure?
Most major insurance covers do. It's really plan specific, so even within a specific insurance company, your employer may or may not choose to provide bariatric surgery coverage.
Okay, real quick, can you do a very quick explainer of the sleeve procedure? A lot of questions on that.
Sure. One way to think of it, if you've seen a picture of the stomach, essentially what we're doing is removing about 75 to 80% of the stomach that's really responsible for expanding in response to a meal. And in doing that, we leave intact, for the most part, the muscular portion of the stomach involved in digestion and grinding of the food. So that volume reduction, coupled with some changes in hormone and metabolism after surgery, helps people reset their thermostat, if you will, in terms of their weight.
Okay, good explainer, and you did it very quickly. Thank you very much. Remember to always consult with your physician about any health concerns, and if you're looking for a doctor or surgeon, Rex has a free information service that can help. Call Rex Health Net. The number is 919-784-4490, and that's a free service. And also, join us next month for Rex on Call. Our topic is all about moms and pregnancies and babies. It's going to be so much fun. I can't wait to hold a baby. So join us July 21st at 1 here on WRAL. Email us your mom questions ahead of time. rexoncall@rexhealth.com. We will see you next time. Thank you so much for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.